We welcome you back to our program today, and we're happy to have Dr. Myla join us today from our friends at Hoag. And Dr. Myla, welcome back to Channel 6. Good to have you with us today.
Thank you very much for having me.
Your expertise in the area of cardiology, and a lot of the work that you do is as the director of the cardiac catheterization laboratories for Hoag.
That's right.
But you also do lots of other things, including even advise some of the medical TV shows, I understand.
I certainly do.
It has to be an interesting and maybe challenging with what they want to do and the reality of medical practice today. Well, when people get to your department, they've already probably had perhaps a heart attack. And you folks are going to deal with how we're going to make this person get well, whether it's through a catheterization process, a stent, possibly recommending surgery, some other treatment as well. But one thing I know that a lot of doctors are trying to do these days is help us all to be better patients and to prevent some of these things from happening. So today I think you wanted to talk with us a bit about some things we could all do to help keep us from having a heart attack. And you talked about lifestyle issues.
Absolutely. I think the heart attack is a culmination of a plaque that is building over years and suddenly ruptures like a mushroom cloud. So the time is essence. We're very good in repairing the artery and saving the heart muscle and bringing us back to normal 95% of the time. Time is of the essence, but time essence in a different sense. If you do lifestyle modification, that was not the time to start eating healthier, eating healthy, living a balanced life, exercise, daily walks. These are important things. Mm-hmm. So anyone wanting to change the lifestyle essentially have to pay attention to knowing to count their calories, eating the right food over 4 or 5 times a day, and then have a easy to use, consistent exercise plan.
I know one of the things they say about exercise is if you don't enjoy it, you probably won't keep it up. So if you pick an activity or a sport that you really don't like, you may be a rapid dropout.
That's very well said. You know, exercise, if you look at it as a chore, we tend to give that up. But if you pick activities that are routine into your day-to-day life, we're more likely to follow. That's the reason why walking is much more reliable as opposed to jogging, going to the gym. Anyone has their own certain passion for certain things, whether it could be swimming, or spinning now is more popular than bike riding. Spinning is a combination of walking and bike. But many of the seniors who have arthritis, it is very hard to do intense exercise. There is really no need to do intense exercise to be heart healthy. What is needed is a consistent plan. So we tell them, buy a pedometer. It costs $8 at a Target. It measures the number of steps. And you can need to put in anywhere from 5 to 10,000 steps. Everyday walk takes small steps. The reason in third world many are skinny, in spite of us, is because their shoes wear out much more than our car tires.
Aha. And walking is relatively inexpensive, like you said, a pedometer and perhaps a little bit better pair of shoes.
Exactly.
And you're on your way.
Right.
I had one cardiologist once tell me that people that have a dog that needs to be walked tend to be a little bit healthier as well, because that dog insists on going out 2 or 3 times a day for a little walk. But they say get a bigger dog, and you have to walk a little faster with a bigger dog.
I think even a smaller dog, the whole idea there is an exchange, emotional bond is happening. You're constantly looking at an animal that is looking for your appreciation. And that combination, it relaxes you. You tend to produce more. Stanford did a study. Those who walk alone as opposed to walk with a company, whether it is a spouse, a friend, or a pet animal like a dog, those who have company, they actually do more and more consistent.
That's interesting indeed. Now, the other side of the aspect, of course, is healthy eating. And, you know, everybody that's watching this program today is probably 55 or at least close to 55 or older. So they've been eating for 50, 60, 70 years. You talked about gradually making a lifestyle change as far as exercise. What about a style change in eating habits?
That's a great question. I know I have gone through my own personal journey, having lost 40 pounds when I switched from a carbohydrate, rice-based background to a high-protein, high-fiber diet. What I found is 3 principles apply. You must know your calories. That's count your calories. Then you spread your calories. That's calorie spreading. Not 1 or 2 big meals. You must eat 5 times a day. And calorie restriction. Majority of us don't need more than 1,200 calories, 1,250. So easy math. 5 meals, each one 250 calories or less.
Eat more often, eat smaller meals.
That's right.
The old 3 squares isn't the reality then today.
No, it's not. The idea of eating frequently keeps the appetite in check, and your insulin levels will not rise. If you eat a big carbohydrate meal, the insulin rises and it stimulates the appetite. That's why you eat a bagel and you're hungry within an hour. But if you eat a piece of turkey or a toast with an egg, you're not as hungry.
Okay. You talked about the fact that you personally made some changes. Growing up, I believe, in India, at least in education in India,
right.
And then in Canada, and then here in the United States. Obviously, the diet was what everybody ate at that time, so you have to kind of be selective and think a little bit about what you order and what you eat. Let's talk about restaurants, because we all like to go out. We don't like to cook every meal. How about eating healthy in a restaurant?
Southern California is a great place. We have phenomenal opportunity to eat any kind of food. But if you see, most of the diet in restaurants is large quantities of carbohydrate. They serve bread, butter, oils in the front, and not so much vegetables. And so restaurant eating requires not skipping your 5-meal plan. So just because you're going to Fleming's, you should skip 1 meal. Suggest eating a few nuts before you go to the restaurant. It's Dr. Oz talks in his book about fat first strategy. Eating a few raw almonds cuts your appetite down. Stay away from the bread that they serve in the morning or right before the meal. They instead ask for grilled vegetables. Cheese is fine if it is small quantities. I think the key is to make sure you ask for complex carbs and then stick with the protein and a vegetable, and probably skip your dessert and instead have some fresh fruit.
Mm-hmm. What about things like potatoes and bread that everybody seems to like to eat? And what's your take on white rice versus brown rice?
If you notice, the 4 no-nos are no rice, no bread, no pasta, potatoes. That's the low-carb diet's essence. It is hard to start, but you will get an incredibly fast response to it. White rice has more sugar than brown rice or wild rice. That's the reason why switching to brown and wild rice will reduce your weight quickly, simply because you don't eat that much. I'm an Indian, naturally. Indian background is eating large quantities of rice. Mm-hmm. In Brooklyn, I switched that to pasta, and my Jewish friend influenced lots of bagels. So it has become very hard. We're switching from one carb to the other. The key is to bring back the old world, like the Ezekiel bread. There is the Milton's bread that's been very old. It's a 9-grain, high fiber, high protein bread. There is a Mahler bread that is highly recommended for people with diabetes. These breads have very low sugar, so it's great for diabetes. It fills you up. And instead of cheese and butter, switch to hummus and more Mediterranean flavors. Mediterranean foods have a lot of flavor, so you don't need to use a large quantity. Example, instead of a cheddar cheese for a salad, or use some feta and Greek cheese crumbles. Small quantity, intense flavor.
We've heard that the Mediterranean diet is, in many ways, one of the healthiest choices people can make.
Right.
What about alcohol? Some are saying a little bit of red wine is good, or some people say any kind of alcohol is good. Others are saying stay away from things like beer, which has a lot of calories in it. What's your take on alcohol?
You hit all the right points. Moderation of alcohol is good. Even Shakespeare said to Macbeth, "It provoketh, but taketh the performance." So too much alcohol is not good, not only because it impairs your judgment, coordination, but lots of calories. In that sense, light beers is a new advance. You're seeing commercials of Miller and Michelob, and those are reasonable alternatives. But red wine, even white wine, is still healthy.
Mm-hmm. How about smoking? I think I probably know the answer.
The smoking should be banned. And Southern California restaurants need to be credited. I mean, they're cleaner. If only you need to go to Europe and see how filthy the smoke around and unhealthy it is.
I understand that they have, in fact, made some changes in Europe. In England and in Ireland, I believe the pubs now don't allow smoking. And I actually heard the other day somebody say that the French are actually at least having a discussion about banning smoking in public places.
The French are still having the discussion while smoking, and hopefully it will improve for the better.
Right. It's interesting because we think that people, for example, in Asian countries seem to be leaner and healthier, yet the incidence of smoking seems to be very, very high, especially in places like China and Japan.
That is so true. In fact, in South America as well, particularly fashionable in young, skinny models and women, is smoking. When I was teaching in Argentina, one anecdote, the waitresses are all pretty and skinny, and when I asked what's their diet plan, and they said smoking.
Okay.
There is a social pressure to smoke.
Yeah. Something else that's very popular in South America is coffee. What's your take on caffeine?
Caffeine in moderation, again, is healthy. There are many healthy benefits of caffeine. The problem with caffeine research is one day you get a positive, and then the next day there's a negative news. So I tend to moderate. Only if you have a high blood pressure or pressure reacts to stimulants, or if you have arrhythmias, you should cut back on the coffee. Rest of us in moderation, 1 to 2 cups a day is reasonably healthy.
All right, some good information, some good tips. I understand there's more information available from Hoag, and of course our personal doctors are a good source as well.
Absolutely. This is the Heart Month, February, and Hoag has partnered with many popular restaurants in Orange County. And Hoag branding will certify the menus there as heart healthy, because having done research on the restaurants partnered with Hoag in creating these heart healthy menus.
Sounds like we need to start looking at the menu and look for that Hoag stamp of approval.
Absolutely.
Some of the menus. And I guess we're all getting a little more active at reading labels as well, and the labeling is getting better as well on the products in the stores.
The labeling law sponsored by the American Heart and embraced by the others is the single most advanced. Right. The moment we know what's in there, we tend to be more careful.
Right. Dr. Myla, thank you so much. Good to have you on the program today.
Thank you for having me.
Appreciate you being with us. A lot of good information available. Again, your own family doctor, but you can also check with the folks there at Hoag, find out more about the good information available, and start looking at those menus in the local restaurants as well. We'll be coming right back with more guests as our program continues for today.
Orange County has a brand new hospital, one with nearly 60 years of experience. Hoag Hospital Irvine offers a wide range of inpatient and outpatient services, including 24/7 emergency care. Centrally located at Sand Canyon and Alton Parkway, just off the 405. Hoag Hospital Irvine, caring for the community.